4 years ago, I was diagnosed with breast cancer and it had metastasized. I was going to die. I developed all of the fear factors you can develop when you hear the diagnosis, cancer. My blood pressure went sky high. I couldn't eat, I couldn't sleep, I cried constantly. I was an emotional wreck because cancer was one of the diseases I feared the most. Now I have cancer. But my fears went through the roof as I sat in a surgical suite one day waiting to have a chest port put in. A chest port is a tube that they put in so they can give you your chemotherapy treatments through. And as I sat there in the waiting room, there were other patients there also, waiting to go in. My fears completely took over. And suddenly these patients looked like zombies, with tubes coming out their nose, tubes in their arms, tubes coming out their necks, red and blue marks on the side of their faces, missing limbs, some of them so emaciated, looked like they weren't even going to survive this visit. And the name on the surgical suite suddenly changed to torture chamber. People were going in there. They were calling their names. They were going in one by one, and nobody was coming back out. All of a sudden, I started crying. I started sweating. I got so weak. My heart started racing. My pressure went so high. My head started aching, and I passed out. When I came to, I managed to go up to the nurse's station, and I canceled my surgery. As I stumbled towards the door to go to my car, my son came to meet me. When he realized what had happened, he said, "Mom, have you lost your mind?" "Yeah," I said, "probably, but I'm going to be okay." Because what I realized was, if I didn't overcome the fear of this disease, I was never going to get through my chemotherapy treatments. And so I sat home for a couple days. Then one day I decided to go to the social media. Yes, I went to Facebook. I put my story out there. I said, "I have breast cancer. It has metastasized. I am afraid. I have some decisions to make and I need prayer. I need help." A gentleman responded. He said he was a physician and he had worked with military personnel who had had traumatic experiences. And he used something known as exposure therapy. Now, exposure therapy is simply a systematic way of making a patient face what they fear until they no longer have abnormal reactions. So he modified the components of the exposure therapy to help me overcome my fear of this disease. It started with habituation. There are 4 main components to exposure therapy: habituation, extinction, emotional processing, and self-efficacy. He started with the habituation stage. I had to say several times throughout the day, "I have breast cancer." And while saying it, I had to write down the things that I disliked about this disease. By the end of week 1, going into week 2, I was able to say it without crying. So I was making a little bit of progress. Then he combined the extinction stage with the emotional processing stage. Now, this stage was extremely important because it helped me to identify the things going on in the back of my head that connected me to the fears of this disease. You see, I had never had cancer before, so obviously there was something processing in the back of my head that made me fear it so bad. What I identified was, as a registered nurse, I had taken care of cancer patients. I had seen breast cancer patients whose breast wounds didn't heal. I had given pain medications to breast cancer patients who said the pain was excruciating. I had seen the breast cancer patients come back from the chemotherapy and radiation treatment so weak they couldn't even turn over. I had seen breast cancer patients when the breast cancer had metastasized to the bones. so severely that they couldn't even stand up because the weight of their own body would make their bones crush. This had attached me to all of these fears, and these are the things that I feared. In order to extinguish some of the fears, I had to learn new information about this disease called breast cancer. The first thing I learned was the diagnosis breast cancer is not synonymous with death. You see, 1 in 8 women will have breast cancer, but 89.7% of them will survive it. We all have cancer cells in our bodies, and breast cancer is a disease of cells. You see, at a normal rate, our body is able to slough off the cancer cells. But when our body becomes so toxic it cannot, cancer cells develop rapidly and take on a disease process of their own. There are many things in our diet that contribute to breast cancer. Hormones contribute to breast cancer. Sugar contributes to breast cancer. So we can alter our diets many times and help to eradicate breast cancer cells. I learned that there are many new treatments out there for breast cancer these days. Immunotherapy. The body's immune system will destroy breast cancer cells. There are medications now that can be given that will boost your immune system to the point that it will start destroying the cancer cells. Cryoablation therapy is another treatment that's being used for breast cancer. This is where they freeze the breast cancer cells and then allow the body to slough them off. Hyperbaric chamber treatments. You see, cancer cells cannot live in oxygenated environments. So the hyperbaric chamber treatment has become an effective way of ridding the body of cancer cells. Duke University has a treatment that now blocks the metastasis of the breast cancer cells to the bones. And if it has reached the bones in early stages, it can be sloughed off and the body destroy the cancer cells. Well, by the end of month 2, I was able to talk about my cancer, think more about what treatment I wanted to have done, and go back into the doctor's office feeling a lot more confident. So there I went into the final stage, self-efficacy, because now I was able to take my belief system deep down inside myself and realize I have the ability to overcome the fears of this disease. And I walked into my oncologist's office and had a lot more to say about my treatment. Now, I stand before you cancer disease free. What I realized was applying these techniques will reduce the powers of the pathological fears and empower me to become better informed so that I could play a greater role in my treatment and recovery process. I would like to leave you with this final thought. Face your fears. One of my favorite authors says, her name is Robin Sharma, by the way, she says, on the other side of your greatest fears lives your greatest life. Thank you.